Welcome to NCLEXMap, the power engine that transforms knowledge into confident action. Today we're exploring one of the most vital transitions in human life: initial newborn care and physical assessment, the bridge between fetal and neonatal existence. In those first 60 to 90 seconds, known as the golden minute, every second matters. Warm, dry, and stimulate the infant. Position the airway in the sniffing position, clear secretions only if obstructed, and apply the pulse oximeter to the right hand. If the infant is apneic, gasping, or heart rate below 100, begin positive pressure ventilation. Assess chest rise within 15 seconds, and correct mask or airway if ineffective. If heart rate remains below 60 after 30 seconds, begin chest compressions. Epinephrine is used only if the heart rate remains below 60 after compressions and ventilation. These first actions are life-defining. The golden minute can determine survival, adaptation, and the success of the newborn's first breath. Next is umbilical cord management. Delayed cord clamping for vigorous term and preterm infants for 30 to 60 seconds enhances iron stores and reduces brain bleed risk. If resuscitation is needed, perform initial steps with the cord intact when possible. Thermal care begins immediately. Place the infant skin to skin on the mother's chest, remove wet linens, cover up to the shoulders, and place a hat. Maintain uninterrupted skin to skin for at least 1 hour. This stabilizes temperature, glucose, and heart rate. Within the first 2 to 6 hours, give the 3 essential newborn medications. Vitamin K, 1 milligram intramuscularly to prevent hemorrhagic disease. Erythromycin ointment to both eyes to prevent infection. Hepatitis B vaccine within 24 hours. Vital signs reflect the transition. Normal temperature is 36.5 to 37.4 degrees Celsius, heart rate 100 to 205, and respirations 30 to 60 per minute. Red flags include hypothermia, tachypnea, grunting, cyanosis, or heart rate below 100. The complete physical assessment within 2 to 4 hours examines every system. Inspect skin color, bruising, and perfusion. Evaluate head shape, fontanelles, and eyes for red reflex. Check nose patency, mouth for cleft, and ears for proper alignment. Listen to the heart for murmurs and palpate pulses. Assess breath sounds for symmetry. Examine the abdomen for a 3-vessel cord and any mass. Check genitalia for normal formation. Evaluate hips, spine, and primitive reflexes for neurological health. If heart rate stays below 60 after 30 seconds of effective ventilation, begin chest compressions. Epinephrine is only for heart rates below 60 after compressions and ventilation. Next, let's talk umbilical cord management. Delayed clamping for 30 to 60 seconds is key for iron stores. If resuscitation is needed, try initial steps with the cord intact when possible. Thermal care starts immediately. Skin-to-skin contact with mom, remove wet linens, and cover the baby up to the shoulders. Maintain uninterrupted skin-to-skin for at least an hour to stabilize temperature and glucose levels. Within the first 2 to 6 hours, provide essential newborn medications, vitamin K, erythromycin, and hepatitis B vaccine. Monitor vital signs closely. Temperature, heart rate, and respirations must stay within normal limits. Red flags include hypothermia, fever, or heart rate under 100. These need immediate attention. The first physical assessment happens within 2 to 4 hours, checking every system for any issues. Look at skin color, inspect the head and neck, and assess the eyes and ears for alignment. Listen to the heart, check lung sounds, and examine the abdomen for any abnormalities. At-risk infants need glucose screening. Treat if levels are too low within the first hours. For hyperbilirubinemia, measure bilirubin before discharge and use the latest guidelines for interpretation. Screen for critical congenital heart disease between 24 and 48 hours. Oxygen saturation is key. For early-onset sepsis, use the AAP-endorsed EOS calculator to guide your next steps. Encourage breastfeeding during skin-to-skin time, aiming for 8 to 12 feeds in 24 hours. Before discharge, ensure stable vitals, effective feeding, and all screenings are completed. Watch for red flags like persistent tachypnea or poor tone. These need rapid evaluation. The first breaths are a miracle, expanding alveoli and completing the transition to independent circulation. This is the science of newborn transition: chemical, mechanical, and sensory stimuli working together. If you found this helpful, like, share, and subscribe to NCLEXMap for more insights that elevate your care.